Beverly and I have had a great run. And I was asked this afternoon, how come Beverly is not here? And I said, well, she doesn't go out unless the temperature's above 25 degrees. So that was it. She's home in a warm house, at any rate. We've had a great run together, and we think it's pretty unusual. It was really a pleasure coming to work every day, because there are exciting things happening, and there are a lot of wonderful, wonderful people who had marvelous ideas here at the medical center. Very talented faculty and staff. I don't know if you know, but the turnover in faculty at the medical center is very low. It's about 5% a year. And these are mostly retirees or those who have come on early and left. And in terms of these young people, and in terms of staff, the turnover is very little too. The overall turnover is less than 10%, and it's mostly 8 or 9%, and it's mostly in environmental services. And the average length of service for staff here at the medical center is about 10 years. So that many people, you all have invested your career at the medical center. That's one of the great things about this medical center. As I've said before, if you show me a medical center that has turnover, and I'll show you a medical center that's not going anywhere. Now, what I'm most proud of, really, at the medical center, with the medical center, I'm most proud of witnessing the transformation of this medical center to what it is today over the years. And this started before I was chancellor, and as Mike pointed out. And the transformation of this medical center into what I believe, knowing the horizon around the country, is the most desirable place to be in the United States at this time in an academic medical center. This is the place to be. Why? Because the momentum is here, the trajectory is significant, the resources are here, it's a good state in terms of the resources. The legislature is very supportive of the medical center, as is the Board of Regents and the president of the university. It has great momentum at this time and great trajectory. Now, this doesn't come about just because there's a chancellor here. This is a group operation. It involved talented faculty, yourselves, talented faculty, talented staff, yourself, who made this all become true. And imagine it's the growing expertise every single day, whether it's in the operating room or in a clinic or in dentistry or nursing. Every single day we make a significant difference with very talented and skilled people. We've had phenomenal leadership here throughout this medical center during the period of my tenure. And no one has a lock on good ideas. Everybody has ideas that tend to be very good from time to time. And it's those that take on those ideas and have an open mind and give everybody credit for what they have contributed that makes this a very unique place. I've been very fortunate to, Belly and I, to be involved in the community. And this started out by beginning, when I became chancellor, what I call a kitchen cabinet. And I know Jim doesn't maybe not remember this, but when I became chancellor, I said to Jim, what do you think I should do? He said, if I were chancellor, I'd go find out what the community thinks of this place. And I did. And I asked 6 people who really are community leaders and also, in my mind, really run the state of Nebraska. Walter Scott, Mike Yanni, Bruce Lauritsen, John Gottschalk, Moens By, and was that 6? Maybe one more. I forgot who the last person was, but there are six individuals that were great. And I use them twice a year, sometimes a little more. And there wasn't any paper. We never used any paper. They wouldn't accept any paper. I didn't prepare any. The only thing was ideas. It was ideas that had come out of you folks. And said, what do you think of this idea? What do you think of that idea? And a discussion would ensue for an hour, and then they would decide. They would say, this is the best, this is a good idea. And maybe we wouldn't do it the way you're doing it exactly, but the idea is a good one. So I got a lot of community support, and through that mechanism, I got to know the community at large, like Chuck Durham, for example, right at the beginning. And that made a tremendous impact. I got to know them. And then after I got to know them, I knew that we weren't going to get any money out of the state. The next step was to see if we can get any support from the community. And with John Neiman and Amy Volk, we put together a team. And from time to time, we would use Mike Sorrell with us, Jim Armitage, or others. And we went gangbusters and found out that these individuals were really interested in supporting their medical center. They were interested in excellence. And it was really gratifying to us, gratifying to them to be able to contribute. And the question that John Neiman always asked was, would you consider this? And your name is a big name in this community. We'd like to have your name on this, whatever it is. And through that, we did very well in raising community support. And I'll tell you that everybody at the university was flabbergasted when we went to the Board of Regents and asked them for their approval to name a new building, something along those lines. During my tenure, we have actually not only new buildings, but we've renewed all of the education space across Nebraska. Not just here, but at other places. In Lincoln, Scottsbluff, this, that, and the other. I'm very proud of that as well. Our student body has grown, not particularly because I wanted it to grow, but because we began to expand nursing, and we added a new college, etc. And gratifyingly, our rankings across all of our units has improved over the years, and this is because of the positive attitude and the can-do attitude on this campus. And the attitude on this campus has been not, we haven't done this before, to how can we get this done, and how can we get it done in the next period of time. And it's been very gratifying to get people together who are on that kind of pathway. I would also like to say something about my office staff, namely Chris Larson, Anita Solon, Patty Maida, and Carol Ann Brand. And they've been very, very hardworking and very loyal to the medical center, have made that office, the Chancellor's office, very, very effective and able to work with the various individuals across the campus and the university. We are today, as you know, in a dynamic healthcare environment where things are going to change. And I'm very proud of the fact that Brad Gritigan and Bill Dinsmore have converted what we used to see as the traditional academic health sciences campus into a clinical enterprise, not only in Omaha, but across the state of Nebraska, that will benefit us as we move to address Obamacare in the future. Now, this is really a dynamic place. We have a new president coming on board very soon. We'll have an interim president very soon. You'll have a new chancellor starting Monday. There's a clinical enterprise that will have to be implemented. A new cancer center is coming up. College of Pharmacy is coming up. There's a new ambulatory care facility, including eye surgery, on the horizon. There's a new hotel that's being planned. There's a new fitness center. And I think those kinds of things are typical for UNMC, and we have the wherewithal to be able to do all those projects. We have the know-how to get them accomplished. We can do whatever we want to do, in essence. Whatever we want to do, this campus can do it. And that's the attitude that we have taken. Now, I believe, and I told this to the Board of Regents on Friday, I say that if you, Board of Regents, and the new administration continues to enthusiastically nurture and support University of Nebraska Medical Center, I believe UNMC will replace football as the pride of all Nebraskans. I hope that occurs during my lifetime. Now, last I would like to say that I'm going to be moving effective Monday to the University of Nebraska Foundation. And that's located in Exarban, right near Walner's. Walner's has a lot of good muffins. I'm a muffin guy. And so that should be a challenge. I plan to be there for 5 months, maybe longer, I'm not sure. And then after that, I will take a sabbatical for a year. And right now, my thinking is I plan to retool in pediatric hematology oncology. And I'll see if I'm healthy. I'll see how it goes. But those are my plans right now. I hope and pray that this institution under Dr. Gold's leadership, despite all of the changes happening in central administration, continues on that trajectory over the next period of time. And I'd like to say, God bless you all, and thank you for your support over the years, and best wishes. Thank you very much for coming.